Good evening, everyone. Representative McCarthy-Vahey, Senator Anwar, Representative Claritas Ditria, and other members of the committee, thanks for taking some time this evening. My name is Paul Kidwell, and I'm here today representing the Connecticut Hospital Association. I'd like to take my time to testify in support of SB 196 related to private equity investment in hospitals, as well as offer comments on HB 5165 related to hospital receivership. As we've testified before in this committee previously, we acknowledge the damage that unregulated private equity investment has caused in certain situations in our state. We have also been concerned that blunt prohibitions on this type of investment could have unintended consequences, prohibiting modest yet important investments that support healthcare delivery. We support reasonable measures to ensure that investments are transparent and to prevent future scenarios where a hospital's financial health is jeopardized by interests other than those of the community it exists to serve. SB 196 reflects a measured approach to this issue and reflects language informed by public hearing testimony last session and developed in partnership with this committee's leadership and CHA during the last session. Related to HB 5165, the primary cause of hospital financial distress is the state's insufficient support of the Medicaid program, which I believe Representative McCarthy-Vahey, you indicated earlier today is something that you hear regularly from providers. Before the use of receivership is considered, we believe that the legislature should task the DPH commissioner along with the DSS commissioner and the secretary of OPM with evaluating and reporting all feasible solutions that Connecticut could adopt to avoid financial distress and operational crisis for hospitals, including but not limited to evaluating how a reasonable and stable approach to Medicaid reimbursement for hospitals would create financial sustainability. In addition, we urge that the bill be amended to require the DPH commissioner to include significant stakeholder involvement in the evaluation. A receivership law triggered by financial distress or operational crisis should be defined in a narrow way and only used if and when all other remedies are utilized. This is imperative, especially when the state's Medicaid reimbursement policies are helping to create the distress and crisis. As always, we look forward to working with the committee throughout the legislative process and are committed to seeking and finding policy solutions to issues affecting patient care in our state. Happy to answer any of your questions related to these bills or any of the other bills before the committee today.
Mr. Kidwell, thank you very much for the basketball update and also for staying here with us. A couple of questions for you.
Yep.
So 196, thank you for acknowledging that, yes, there was extensive conversation last year, both here around the circle and as well after as we continued to meet together as leaders of this committee with you and many other stakeholders. So I appreciate that. My question is, do you think that 196 is the end of the conversation about private equity in healthcare?
I suspect it's not the end of the discussion. I think it's a good start. But I appreciate that you and your colleagues likely have some other questions and some exploring that you'd want to do related to private equity. I think we're learning more and more about how it's used, not just here in Connecticut, but across the country more every day. So certainly welcome those ongoing conversations.
I appreciate that answer. And yes, you're right. You suspect and you, I think, know that we will have other conversations. I think it's going to be an ongoing one. So I think that 196 is a good step for us to take. I appreciate also your comments on the receivership proposal, the bill before us, and I do look forward to having some ongoing conversation about how we might look forward to that. I specifically appreciate your ask to include significant stakeholder involvement in that conversation with the commissioner. Senator Anwar.
Thank you so much for your testimony. Actually, at the basketball, they just said, oh, the testimony is at number 71. This is the bigger game in town right now.
My daughters and wife at home have been sending me updates and are very distressed about the closeness of the women's game.
I'm sorry, if you don't mind repeating the receivership part.
Oh, sure. So I think we generally understand the interest there. I think we would like to see the bill expanded a bit so that not only is the study looking at whether receivership is a good idea in certain circumstances, but that the DSS commissioner, the DPH commissioner, OPM commissioner are also tasked with identifying opportunities to ensure that the state is helping to prevent the circumstances which lead to hospitals potentially needing a receivership. And I think we've testified before this committee, the Appropriations Committee, and the Human Services Committee related to the Medicaid underfunding in the state, which leads to a $1.5 billion shortfall every year. And for certain hospitals where their government payer mix is significant, that Medicaid shortfall becomes a hindrance to financial stability.
Yeah, we get that. I think obviously it's multi-layered issues. There's so many variations that the hospitals are going through, and between the insurance industry's bureaucratic process, the Medicaid funding, your hospital tax, and so on and so forth, and the issue comes down to is that in other states, when things got pretty ugly, there have been like 6 hospitals that we are having transactions on right now, and or perhaps even more by the time things clear up. And if something fell through the cracks and there wasn't a larger entity, or the state did not show the leadership that it's showing right now with the Yukon, the hospitals could close. And then that means certain communities, and most likely the vulnerable communities, would have the problem, because that's where it comes down to. So we need to have a receivership, and that should be looked at separately from a plan to address the challenge if it gets to that point. The preventive strategy obviously is a conversation that would be outside the scope of this bill. I completely recognize, respect, and we'll work on the other components of the prevention to get to the demise of a hospital. But if there is a demise, what do we do? That's the part.
Yeah, so appreciate that. I think our perspective is we should cure the problem before we have to take the medicine. So appreciate it. In the instance of the bill, I think we need to think really hard in how we define financial instability. The 2 Prospect hospitals are not the only 2 hospitals in Connecticut that are looking at financial instability. If you look at hospital margins across the state, they're at 0, slightly above 0 over the last 3 years.
Yes.
So we have a chronic underfunding problem in our government payers that is creating those situations. And if we're going to advance a receivership study, which we think is not an inappropriate thing to do, we do want, though, to make sure that when we're thinking about financial instability, we're talking about what that measure looks like. Because I don't think it's I don't think it's the intent of the legislation that the state of Connecticut would be then, like you said, looking at multiple hospitals in receivership in any given year. I think it needs to be used judiciously, and I think that's likely the intent of the bill.
But this happened in Massachusetts, and in other states too. In Massachusetts, they were able to intervene, and the state was able to intervene and protect a hospital. So that's and the state of Connecticut does not have that mechanism at all, and had something fallen through the cracks, we were going to have a large population without health care. And we don't have that safety in our state, and that's what the bill is. And I want to look at that bill separately as that safety valve, which hopefully, and we pray that we'll never have to use, but we need to have something like this. The problem with larger healthcare systems is that if the state breaks it, they have to buy it, right? And right now there's no mechanism for the state to buy it when they break it. And there are so many things that you're speaking about that are going to slowly break many of the healthcare systems, but we have to figure out a strategy to prevent that. That's going to be a separate bill and separate conversation. Perhaps a lot of that is going to be outside of the scope of our committee.
Yeah, definitely understand it. In this instance, the state had plenty of opportunity to help make sure that those 2 hospitals didn't get into the position they did, right? They had a willing buyer, and they had a CO1 process that took more than 300 days to complete, which caused those hospitals to go into even greater financial instability. So, Senator, appreciate that you want to make sure that there is an apparatus for when things don't go right, and we appreciate that. We just don't want the cure to get left outside of this discussion, and appreciate you don't have jurisdiction over everything. But it's critically important that we look at this holistically.
Thank you. Thank you for your testimony. Thank you for staying with us for.
I always learn something when I'm here, so I appreciate it.
Thank you very much, Senator Anwar. Senator Gordon.
Thank you, Madam Chairwoman, and thank you for the testimony. And I'll preface my remarks that anything I say doesn't mean I intend anything negative about the work that hospitals do. I've worked at a number of different hospitals in Connecticut, and proud to have done so. You've mentioned, I'm trying to understand your testimony. I've read through the written testimony on 5165.
Mm-hmm.
I'm just trying to understand your testimony. You talk about dealing with the cure and not taking the medicine. Not certain that's the right analogy. Many times to cure someone, you actually have to give them some sort of treatment.
Maybe poor analogy on my part.
As I was continuing to talk about, I'm just trying to understand your testimony in 5165 in the written testimony. Are you saying that the Connecticut Hospital Association is opposed to the
No.
bill, or looking to see what to do to perhaps make the bill better? I'm not
Looking to see what
understanding.
we can do to make the bill better. We are not opposed to the bill.
Because it would seem to me that if a hospital is in distress, we can learn from some of the things that were done up in the Commonwealth, right to the north. I mean, this was unfolding up there before state government decided to even acknowledge there was a real problem with Prospect Medical here, despite alarm bells ringing and I think the fire raging. And things got horrifically bad up there, as I'm sure you know, with Steward Health, a gigantic mess and 2 hospitals lost, including an emergency room in the central part of Worcester County, which is going to be rectified in a different way, but still a disaster. And a lot of folks lost their jobs, unfortunately. So I'm just a little confused by what you're looking to make better or proposing to make better. If a hospital is to that degree, I think there should be a mechanism for the state of Connecticut to have to step in. We can't have hospitals outright fail, and I know there's discussions about Medicaid reimbursement, and that's related but somewhat separate, and I agree we should be doing more over time to help with the Medicaid reimbursements. But there's other things that go into issues with regards to hospitals having financial problems. So I would hope that if Connecticut Hospital Association is looking to, I guess, make this bill better, I'm trying to understand, are you saying you don't want to have a receivership option or the state to have to step in if there is no choice to prevent a hospital from outright shutting down? Patients then no longer have access to care. There might be an emergency room that completely is gone, and that's horrific for emergency care, and then potentially thousands of healthcare workers lose their job. I'm just a little not clear.
Yeah, we think the bill can be improved. We're not opposed to the bill. We're not opposed to a study of a receivership. We think that there are things that we would think stakeholders should be involved in the study. I think we need to think hard about what financial instability or operational instability means, and we want to be part of that process. So we are not opposed to the bill. We think it can be improved with stakeholder involvement. We think that the issues that cause the financial instability should be considered as we move forward, but again, not opposed to the bill.
No, thank you. And then one question I have relative to, I've read through the testimony, and you also had provided information. I think it's on 196.
Yep.
And I'm just trying to, and I just want to make certain I understand the testimony from the position of the Connecticut Hospital Association being in favor of exempting certain situations of these sale-leaseback transactions from the provisions of statutes 19A-486A through H, which means exempting from certain approvals. I'm just trying to understand if that's what the testimony is.
Yeah, so we support the bill as drafted, and that includes that exemption. And what we talked with the leadership of the committee over the last session was there may be circumstances in which those types of transaction may be appropriate. And that was the outcome of that discussion, was inclusion in the legislative language.
Let me rephrase my question, if I may. I'm just trying to understand, you know, there's provision in this bill that's written to say exempting certain approvals that are built in already to current state statute. So is it the position of the Connecticut Hospital Association that those exemptions that then could be granted if this bill becomes law, that the Connecticut Hospital Association is okay with then having exemptions from certain approvals that are
In those
required now?
limited, in those
Well,
limit-
as I was just, let me just finish if you don't mind. But exempting then those transactions from certain state approvals, including by the Attorney General, is that the position of the CHA?
in those limited circumstances, yes.
I would just say that I'm opposed to the bill and to that thinking. I think if a hospital is in distress, seeing what damage has been done already with some hospitals that had to deal with getting into these lend-lease, REITs, if one's in that much distress for whatever reason, for example, not good Medicaid reimbursement, and that's not getting better, then all one doing is piling more harm in an attempt to maybe make good, because those payments have to still be made. And so if you're piling on more debt, it makes the financial situation even worse. I think all the more reason, if one supports this bill, one has to support a strong ability by the state of Connecticut to have to step in if there's a financial distress that could cause a hospital to close. Because to me, it would seem to be making a deal with the devil from a financial point of view. I don't see that ends well. I think we have enough history here in this state, the Commonwealth, and even Rhode Island and some other states. So I just am very concerned about it. I don't see any good will come of it, and I think it sets up even more for a disastrous failure. And again, begs that the state should then have to have more oversight and approval. Thank you, Mr. Chairman.
Thank you, Senator Gordon. Mr. Kidwell, can you speak to why you, as the Hospital Association, have supported and are in a position to support that aspect of the bill?
I think our experience with the state in related to financial insecurity is that the state hasn't ever proffered any support that would address the situation. And so two sessions ago, we now report a lot of information to OHS related to our financial health. And OHS is required to reach out to us if they think that a hospital might have some financial issues. But there's no cavalry that comes along with it. So to the extent, as part of this process, we want to discuss what that support might look like. Absolutely, we should discuss that. And what state processes the hospital needs to go through in order to avail itself of that assistance, we're absolutely supportive of that. But that's not the history we've had thus far. And so what we do is look into the private market to see how can we support the enterprise. Again, in the situation with Prospect, completely inappropriate behavior in that instance. There were actions that led up to the eventual bankruptcy that could have been avoided through a state process. I know we're going to be talking about the CON process in this committee in the future, and I think that's a really important part of ensuring that these hospitals don't go into severe financial distress. So I think there are a plethora of things that we can do to make sure we avoid these situations in the future. We support 196 as drafted. If it's the committee's intent to continue to look at the language and perfect it, we'd be happy, of course, as we were last session, to be at the table and talk about those things.
Thank you, Mr. Kidwell. We appreciate you staying with us and for this protracted conversation, which I think has been helpful, actually.